It can result from a traumatic experience or be part of your family history. It can be brought on by childbirth, poor physical health, and even short winter days. No matter what the cause, should depression strike you, don't be ashamed. We all go through tough times, according to our guest on this week's Health Talk. She's an expert in behavioral health. The good news is for those with clinical depression, help is available. So stay tuned for today's show, Coping with Depression. We're up next. Hello, I'm Dr. Eric Mazer. Today our topic is coping with depression. Joining me is Kathleen Cheslok. She's a behavioral health therapist at the Department of Psychiatry at Norwalk Hospital. Kathy, great to have you back. Thanks for joining me.
Thank you, Eric.
So we are talking about depression. Highly prevalent, everybody been depressed. Let's maybe talk a little bit about what is depression that needs a therapist or needs help versus having a bad day.
Usually when people are not functioning the way they normally are, if you can't go to work, it's one thing if you just can't, you're a little sluggish one day, but if you're calling out sick or you're crying a lot or you have no motivation or you start having physical symptoms, anxiety can be part of depression and so can pain. When it impairs your functioning on a daily basis, that's when you need to go and talk to someone.
So it's really when you're not living the life you expect to be living, and part of it. Now you said that you also mentioned that anxiety can be part of depression. We sort of think of them as opposite ends of the spectrum. They're really not, are they?
No, depression can manifest itself in many different ways. The sadness, the hopelessness, crying, but it can also manifest as anxiety, and people get confused. But it's really it can be based in depression.
And you also mentioned pain. Is this psychological pain or we're talking about physical pain?
I'm not sure that anyone can answer that. It's just a phenomenon, and a lot of medications can help, exercise can help.
Well, exercise seems to help everything these days.
It does, yes.
So again, we've got a lot of folks at home who are really, I guess a lot of us begin to think, when is this abnormal? When should I get help? When do you recommend that people reach out to, and who do they reach out to if they think they might be depressed?
Oftentimes they start with their primary care doctor. If you want, you can easily just call a therapist. You can make an appointment with a psychiatrist. Sometimes talk therapy can be helpful, and that's all you need. And when you can't function and there's a consistent decline in your ability to get through your daily life, that's when you need to reach out for help. You know, not cleaning your house for a week or two, but if you haven't cleaned in weeks or months, that's when you want to seek help.
I don't think I've cleaned it in my life. I'm sorry. My wife should not, I will not let her watch this show. She can't watch this, anyway. But yeah, depression, it's really common, isn't it, too? And why do you think it's so common in our everyday life now? I mean, clinically important depression is very common.
Right. I think we have a lot more awareness. You go back to colonial times, you were depressed, go out in the field and go get some food for the next few months. We have a society where you're almost allowed to feel more now. It's more acceptable to discuss.
You're not distracted as much by simply staying alive, without, and that not meaning in anything pejorative. That people just were concerned about staying alive.
And they had one focus. Now, we all know what we're distracted by. Mm-hmm. And there's a lot more pressure on us. We have social media. We have standards that didn't exist many years ago.
You also have knowledge of other people, the celebrities, the wealth, some of that you think you should be having this fabulous exotic time in the islands with these beautiful people, and you're not.
Most people are going to have an average life, and that's a great thing. Just enjoy what you have. But we hold ourselves to the standards of unrealistic expectations, which sets you up for depression.
Mm-hmm. And we mentioned in the introduction, family history. Does this run in families? Is it genetic? Is it?
It does, and we can see it. One of the things that the therapist will usually ask is, is there anyone in your family that has any mental health issues, depression, anxiety, bipolar, and schizophrenia? Most of the time you're going to find out that somebody in the family has it.
And that raises your risk of depression?
Absolutely.
So you did mention seeing your primary care physician, and I think that I just wanted to emphasize that primary care physicians are being trained more and more to deal with depression, and I think it's a low risk or a low stress touch point for the medical profession, because you should be seeing your primary care physician for other things: blood pressure, diabetes screening, cancer screening, etc. You should mention that to your primary care physician.
Absolutely.
Because they can either direct you or in some instances treat you effectively themselves.
And they can direct you to a therapist. I work in primary care, and they send a lot of patients to see me, and either I can refer them out or they can see me for a few sessions right in the office.
And we know a lot of times people who are depressed end up with other medical symptoms that they're seeing doctors for, because I think there's still a stigma attached to mental illness, isn't there?
And people don't like me to say, well, does anyone in your family have mental illness? They'll tell you they have depression or anxiety, but no one considers that mentally ill because there's the stigma.
Yeah, that term, I think, has a very negative connotation.
Absolutely.
And we have to, I think, and hopefully it's changing. I actually remember, and this may even be before your time, there was a vice presidential candidate who admitted he was being treated for depression and had to resign I've forgotten his name already, but he actually resigned from the ticket because of the stigma attached with being treated for depression.
And instead
that
of
was during
using
my lifetime. That wasn't that long ago. That's pretty severe and pretty inappropriate now that I think about it.
You're right on that account. And instead of making it a national campaign that it's okay to have some symptoms and to work on it. And that's always the most important thing. What are you willing to do to help yourself?
And take us from there. What can people do who are feeling depressed and it's getting in the way of their life?
The first thing is really to acknowledge that you're not feeling so great. Have acceptance. This is what's going on, and realize you do have some control over it. Not 100%. I don't mean to say that you have 100. You can totally control it, but you can exercise. Sometimes reading a book, and sometimes meditating, and sometimes just going out with friends.
And then these are all things that seem almost trivially simple,
Yep.
and yet they can really affect depression. Depression has a way of feeding on itself too, doesn't it? When maybe I'll let you answer that rather than me philosophize, but you can start depressed for maybe a bad day at work, but it can feed on itself because you're depressed.
Well put. I think that describes it. And then you feel badly that you're not doing things and you're not measuring up to your own standards. That makes you feel worse. And instead of jumping off that gerbil wheel and then going out and saying, hey, let me go for a walk. Let me go join a local club. Well, I'm not worthy. I can't do this. It feeds off of itself.
And you mentioned meditation. Maybe you could say a few more words about that, because I think for the longest while, maybe, again, in my youth, it was considered a little bit out there, something that only the crazy hippies did. And now we're really learning there's something to be said for living in the moment and for the process of meditation. Do you want to say something about that?
Yeah, meditation is wonderful. It distracts you. It gets your mind out of that negative gerbil wheel pattern and allows your mind to free up. And it's a stress reliever. So it takes the stress off of yourself and the pressure you just put on yourself.
And maybe I'll add something to that. I think as someone who's used it, it's not something that you suddenly say, well, I'm going to meditate, and you go off to the room for 15 minutes, you meditate, say, oh, I'm all better. I find you really have to learn how to do it properly. You have to train your mind to truly release the stresses and live in the moment for that period of time. So it's a learned process. You don't want to, I think it's naive if you think you're just going to do it and it's going to make you better in the next 20 minutes.
It's not antibiotic. It's
Right.
like anything you want to get good at.
Even they take a few days to
Yes. Anything you want to be good at, you have to work at. And you have to keep pursuing it. And even 2 minutes, I recommend 2 to 5 minutes twice a day to get started until you're used to it.
And that's real time. If you're doing it, 2 minutes is
It's a long time.
it seems like a long time.
It
5
is.
minutes is a real long time. And the breathing I also found very, very helpful. What I guess the Indians call the Pranayama. But just by focusing on your breathing, you don't focus on the other stuff.
And that's exactly what why distraction works, that you're so busy counting, and whether you're breathing in, breathing out, proper belly technique, you don't have time to worry about anything else.
And it's really now we're at that time of the year where the days shorten, and we're learning about seasonal affective disorder, or SAD, which I think is sort of an interesting acronym. And it turns out to be a real thing, doesn't it? That less light for some people triggers true depression. We used to think it was just the holidays, but it's probably more than that.
And that's why it gets worse in January. It's not just the letdown from the holidays, it's also you're really settling into the darkness of winter. Light boxes help, and also getting out during the day. Go out for a walk during lunch. If you have time during the day, just go run errands. You're in and out of the car.
I've also often wondered whether the profusion of lights associated with the Christmas, New Year's holidays was actually an evolutionary response to this very real phenomenon that we...
And that would be positive if that's the case.
You know, exactly.
I let my patients be creative. I try to just spark their creativity and let them run with their own ideas as to what's going to make them feel better.
We were running out of time. We only got a couple of minutes, but I don't want to overlook medications, because this is an area where there's been, I think, tremendous advances over the last 20 years, and where there are really effective medicines with minimal side effects, with, I think, very dramatic effects. You want to say a few words about that?
Absolutely. There are many different classes of antidepressant medications we can use. Some are better for the people that have pain. Some antidepressants work better on the depressed patients who have anxiety, or the hopelessness and sadness, crying. I warn people it can take a couple of different medication trials. If you're on one medication, we always try to increase it or decrease it to see if that would be effective. And really, you need to try it for about a month to 2 months. And you are right, they have almost no side effects and no long-term effects, which is even better.
And I think, again, it's not like an antibiotic. It is not effective the first day. And for some people, I think they even get worse a little bit for the first few days, first week, until their body gets used to this. And you may need to start at a lower dose. So it's not a simple process getting them on, but they can be very, very effective. And it's surprising to me how many people I talk to now that are taking these medicines, maybe because of our society and the way life is, but very effectively. And really, it helps them have a good life.
It does. It has changed people, and mostly for the better. And I do recommend talking either to your psychiatrist, your primary care doctor, or a therapist to help you figure out how it's best for you to take a medication. Some people have to take them at night, some take them in the morning. It's a lot of minor adjustments that can be worked on.
And you want to work with your professional to do that. And recognize that I think medications help. Talk therapy may help, behavioral therapy may help. It's really a mixture of all these approaches that can really allow people to function normally and happily.
And that combination is the best.
And we have to stop there. But unfortunately, we have run out of time. I want to thank my guest, Kathleen Cheslok, for joining me on Health Talk today. I want to thank you for watching. Please remember to share your questions and comments by calling Community Relations at New Vance Health, 203-852-2250. We'll see you next time.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery.
Protect the ones you love.
Spot a stroke, F-A-S-T, fast.
All of us experience occasional anxiety. Anxiety is a normal part of life. But if feelings of anxiety are intense and impair your everyday activities, please know that help is available. On this week's Health Talk, I'll be joined by a behavioral health expert who will discuss the symptoms, causes, diagnosis, and treatments for anxiety. So please stay tuned. We're up next. Hello, I'm Dr. Eric Mazer. Today our topic is anxiety, the most common mental illness in the United States. It's been estimated that anxiety affects 18.1% of the adult population of America every year. Joining me is Kathleen Cheslok. She's the behavioral health therapist in the Department of Psychiatry at Norwalk Hospital. Thanks for joining me, Kathy.
Nice to be back.
Anxiety. Everybody's anxious in this world. Now we've got the pressures of social media, constant communications with our friends, different ways to date and relate to people.
No breaks.
Working from home. The world is changing so rapidly. Lots of people are anxious. When does it become a problem?
When you can't function. When you can't get your thoughts focused on what you need to focus on. We all have moments where you're distracted, maybe something good's happening, maybe something not so great's happening, but within a short time you should be able to get back to life. When you find you can't keep going, or your thoughts are distracted, or you're shaking so much, or you're having panic attacks, your heart palpitations, you're ending up in the emergency room.
Yeah, I've heard of people thinking they have heart attacks, commonly presenting as that when it in fact is an anxiety attack, or people not able to get their breath, terrible shortness of breath. And so everybody experiences anxiety.
It's normal.
I'd also add from personal experience anxiety when it starts to become insomnia. Those two I know will occasionally go together, and that can be very distressing and interfering.
And sleep is very important.
And sleep is very important. So let's even start with normal anxiety. You don't want to let that overwhelm you either. What are some good ways to help cope with a stressful life, with real stressors, people get sick, real problems at your job, money issues? How do we deal with that?
Take a short break if you can, whether you're at work, you're home, walk outside for a minute. Sometimes at work, if you're upset and anxious about something at work, maybe it's okay to check your personal email for a moment. If your phone's making you crazy and making you anxious, then you need to go and get out of your chair. Just go outside for a moment. You can also watch some really nice YouTube videos, whether it's meditation or a dog video.
Just things to distract you?
Distraction, it's perfect.
And how long can it's hard because people are in a stress-filled work environment. You can't take hours off to do this.
You can take a bathroom break. Go to the bathroom and wash your hands if you have to. Walk around your floor at work. If you're home and the kids are making you really anxious and you're really distressed, make sure they're safe. Go downstairs or upstairs and go put a load of wash in. I tell people to clean the bathroom. That is a great stress reliever. And they can come to my house.
That's what I was just going to say. Send them all my way. That would be great. I imagine it'd be very hard for a single parent who's home with young children.
Yeah. And worried about money.
And
trying to find a job.
And having those children to take care of, because it is hard to even get that small break where you're not worried about your kid's safety.
Right. And sometimes, getting another mother together, you can watch each other's children, or just getting the kids together and having someone else in a similar situation to you.
That you could adult talk to?
Exactly. Who just can understand where you're coming from, and you can share safely and not be judged.
And I know that, again, people talk about exercise being good for almost everything.
Number one.
Another thing in terms of helping you deal with anxiety. And I think that's been shown in clinical studies that you can reduce anxiety.
No doubt.
With regular exercise.
And more strenuous exercise is better.
So you want to be short of breath.
Right. But you know what?
And
If you
sweaty.
have to, take the kids out for a walk, take yourself out for a dog. Anything you can do, go by yourself. If your neighborhood isn't a great place to go walking, get on a bus or take the car and go somewhere. Most of us live within 20 minutes of a beach, and most of the beaches are open all winter long.
And it can be quite beautiful in the winter, so
Yeah.
there aren't a lot of people there. So let's talk, that's sort of, and we all experience that. This is just a pressure-filled world, and there's a lot of pressures on us. We all have to make a living and take care of our family, and sometimes they can be overwhelming. How about when it becomes a problem is when it starts to interfere
Yes.
with your life? And tell us more about that. What are the warning signs? Who do you seek help with, et cetera?
So the most important thing is to recognize your warning signs of your anxiety and your panic attacks. You know, what might be triggering them? Sometimes it's external, sometimes it's internal. And then how are you feeling? Use more mindfulness to be aware of both your mental thoughts, your physical reactions. And then you can go to your primary care doctor, you can seek the help of a therapist or a psychiatrist, and start an open dialogue and be very clear about what you're experiencing, and be open to seeing someone and talking and receiving help.
Now, you've mentioned panic attacks several times. Do you have to have panic attacks in order to have anxiety, pathologic anxiety?
No. They can be separate. A lot of people get both, but the panic, it can be frozen. It's usually the most impairing. We might have had
And they're dramatic, so I think
Yes.
you know.
More physical.
Yeah, because you know you're having dramatic shortness of breath or chest pain, or you feel lightheaded or whatever.
Right.
Which is so that's a sort of a dramatic way of presenting with anxiety, but you don't have to have that.
No, some people just have ongoing steady, someone recently described it as having like a strong river running through their life, and they can always feel it and hear it, and it's just pervasive and it's distracting.
Yeah, and I think if you have it, you know what's going on, and if it's not more than occasional, it's a problem.
Right.
It can be a problem. So what types of things patient sees you for anxiety? What questions do you ask? What things do you do?
Well, we ask about family history to find out a little bit about that. I ask what they have tried. Has it been successful? What's not working? And if it has worked, why aren't you doing it some more? Oh yeah, when I used to go to the gym, it helped. I often ask people to try to do something physical, whether it's going for a bike ride or it could be cleaning. Go outside and rake leaves.
At
then,
my house.
Yeah.
Bathroom and leaves we'll take, and gutters I'll take as well.
And then the flip side is to do something more calming. Some people, whether it's meditation, prayer, thoughtfulness, and YouTube and Google, you can Google just deep breathing. They have some great videos to demonstrate it. They have videos of scenery, or they have self-guided visualizations and meditations that tell you, think about this, look at this.
And these things, again, I think it's not look at it and in 3 minutes you're going to be cured. You've got to really train your mind to use these tools. So don't be impatient, don't give up.
And that is a key point, that it's like anything in life. If you want to get good at it, you have to keep practicing.
So that's even practicing how to relieve your anxiety.
Yes.
So it sort of seems a little strange to practice how to control anxiety, but you really can do that.
My recommendation, I write a prescription on a piece of paper to my new patients. 2 or 3 times a day for 2 to 5 minutes, do deep breathing and a meditation. Short, but it gets you trained, and then you can do it for longer.
And I want to emphasize, this isn't just deciding to breathe deeper breaths. There are ways to do this where you're focusing on the airflow, whether your diaphragm's moving, et cetera, that help you to concentrate on that breath and take your mind off whatever else is troubling you, redirect
Very
your thinking.
specific methods.
Now, back in the 70s. People talked a lot about Mother's Little Helper. The Rolling Stones wrote a song about it. We were talking about tranquilizers, the benzodiazepine class of tranquilizers. Valium is probably the one that people know the best. They really very effectively relieve anxiety. They were thought to be, I'm not going to get skepticism here.
Short term, they're terrific.
That's what I was going to get at. That I was actually taught that short term this is back in medical school in the 70s. They're not addictive. That there are essentially no side effects. That the only way to kill somebody with Valium was to bury them under a pile of it so they couldn't breathe. We've learned that they can be effective short term, and that makes them very attractive to somebody who's suffering. But they have some longer term consequences, don't they?
They do. They're highly addictive, and
I say that again. They are highly addictive.
Very highly addictive, and some people have a significant struggle, and they become more anxious trying to get off the medications.
And even stopping them, you may get seizures. You can actually get quite ill in the withdrawal syndrome. Now, it's not possible it's very possible to stop them if you're taking a long-term benzodiazepine slowly over a very long period of time. It is very possible to safely and comfortably stop these medicines.
You work with your doctor on a slow taper decline.
But they can be very difficult to stop. And
but effective short term until usually we use antidepressants.
Which is interesting. Antidepressants working for anxiety. You might think again that that's counterintuitive.
But it works most of the time. And then also it's, like you say, the behavioral side to changing your behaviors and reactions to your symptoms.
So this is not there's not a single magic bullet.
No.
I think we've mentioned behavioral therapy, we've mentioned drug therapy, using antidepressants. Maybe you could say a few more words about that. Anxiety and depression are really, they're kissing cousins, they're not polar opposites.
That is a true statement. And a lot of people think they have an anxiety disorder, but it's based in depression. But the other tricky thing is you may have an anxiety disorder and you're so worn down from the anxiety, you become depressed.
That's very interesting.
But usually, most of the time, the antidepressant medications and the various classes can work on anxiety.
No, the antidepressants, aren't they addictive?
No. And they have very few side effects. You need to go up slowly till you get to a therapeutic dose that's good for you. And if you want to come off them, it's a pretty quick taper. Yeah. But
depends on the antidepressant, though, doesn't it?
It depends on that.
Some can be tapered much more quickly than others.
And it depends upon the person. Mm-hmm. And the key thing is working with either your therapist or physician to help you understand how it's best to use these medications and how to get off of them if that's what you want to do in the future.
So medications, exercise, behavioral therapy, and we don't have more time to talk about it, but talk therapy would be the third.
Yes.
To have somebody you can talk through some of these issues with.
Yeah.
And it's really just for support. It's not magic.
And uncovering maybe past issues and maybe there isn't anything. Maybe it's just learning how to change things on a daily basis.
It doesn't have to be necessarily a trauma in your life to be depressed.
No.
You can just
have anxiety.
Chemistry.
Right.
So unfortunately, I could talk about this all day. I think it's a really important topic that affects so many of us. Unfortunately, we've run out of time. I really want to thank my guest, Kathleen Cheslok, for joining me on Health Talk today, and thank you for watching. We'll see you next time. Remember to share your questions and comments with us by calling Community Relations at Nuvance Health, 203-852-2250.
When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery.
Protect the ones you love.
Spot a stroke, F-A-S-T, fast.